Hello, I'm Dr. Philip Mease, Director of Rheumatology Research at Swedish Medical Center Providence Health in Seattle, Washington. I have just returned from EULAR 2025 in Barcelona, which was a busy and productive meeting. I'd like to make a few comments about interleukin-17 inhibitors in PsA as represented at the meeting. One of the things that is a key question is there a difference between IL-17A inhibitors such as secukinumab and ixekizumab and the IL-17A and F inhibitors such as bimekizumab or sonelokimab? We don't have a head-to-head trial, but we have some interesting translational data that was presented by Ian McInnes, in which patients with PsA who were first initiated on a TNF inhibitor and then subsequently were treated with bimekizumab, an IL-17A and F inhibitor. There were two classifications of patients, one group that were considered inadequate responders at week 16 to the TNF inhibitor, and this was judged by lack of achievement of a PASI 75 response or a PASI 50. And the other key element that could have been evidence of inadequate response was non-achievement of a swollen joint count of 0. They did a number of interesting analyses of the blood work of these patients and found that the patients who were inadequate responders at week 16 demonstrated increased expression of an IL-17F gene signature, thus raising the possibility that this may partially explain the quite good response and persistence of effectiveness we've seen with the IL-17A and F class of medications. Of course, until we have a true head-to-head in psoriatic arthritis with one of the IL-17A inhibitors, we can't know whether or not this translates into clinical outcomes. But we did see some really good long-term data with bimekizumab. There were two reports about 3-year efficacy of the both Be Optimal study, which were patients who were biodemar naive, and the Be Complete study, which were biologic experienced patients. And in both of these, we saw quite good 3-year sustained efficacy. For example, ACR 50 response of about 53 to 55% in the two studies, PASI 100 of 62 to 70% in each study, respectively. Achievement of minimal disease activity in 53% of patients in both studies, and swollen joint count of 0 in about 63% of patients. So this is an example of quite good sustained efficacy. The safety data from this medication at 3 years was nothing new. We saw a few candida cases. There was a very low number of uveitis cases and IBD cases. We also saw 2-year radiographic data that showed that 84% of the total population of these studies that were assessed by X-ray were non-progressors, and 82.4% in those that were at risk for progression, having an elevated CRP or at least one erosion. So this underlines the value of IL-17 inhibition in general in psoriatic arthritis, which is very important, especially as we have more and more patients that have lost response to previous treatments. And we are also seeing some sustained efficacy data with the IL-17A and F inhibitor, bimekizumab. For more information, go on over to RheumNow for all your news about the EULAR meeting.